Thank you, Mr. Chairman. Thank you, Secretary. Welcome.
Thank you, Representative.
I was looking at some information from your testimony on the options program.
Yes.
That's something that my constituents I hear a lot from. My district's the 139th district. It's very large. I think it's over 750 square miles. In-home care and in-home service is a real challenge, whether it's health care or any kind of service that's performed, simply because it's so far to travel in a day to provide those services. And of course, the reimbursements that some of our agencies are receiving aren't adequate to basically cover their bills. So I saw that $20 million there, as well as the home delivered meals, and I was excited to see that, because that's something that I hear a lot about when I am actually home. You do talk about the $20 million used to decrease the waiting list by 5,400 older adults. What is our overall waiting list? I mean, is it...
Right now, the waiting list is at about 5,400 individuals. Home for you would be about 240 people waiting for services. If we look just at county counts, I don't think that's exactly according to your district.
Okay, so when you say 5,400 individuals, that's the total waiting list right now? I mean,
right now.
Okay.
That's our waiting list right now for the options program.
All right, so that's great news.
Right, that's great news.
It's great news that we're there, we've got this money to help them.
The additional, that's right.
Yeah.
And so we want to use these funds to either provide home and community-based services or help remove people from that waiting list.
Right,
so
because the way I read it, it says helps decrease it, but it doesn't say it eliminates the waiting list.
That's right. I don't think that'll be possible, because it'll continue to grow at the rate it's growing. And but we.
So you're saying is that probably 5,400 per year in the future?
Well, let's say we don't have access to that increased funding for the options program, and we're at 5,400 now, and we sit here in the month of February. So I can't guess what the number will be by the end of the year, but it could be as high as 8,000 or 9,000 individuals waiting for services, and that would concern us. That's why it's important that we have enhanced, sustainable, predictable revenue sources moving forward.
So basically, this $20 million is something that's going to be needed in the future, because this, with our aging population, is going to continue
in the near
to grow.
future.
In the near future. My second question really dovetails off of those asked by the representative from Bucks County. We look at your allocation formula for the AAAs, and that comes through the cooperative block grant monies.
Correct.
And it looks so good. You start with the census data of 2010, and then you've got the factors, which are the weighted factors of persons 60 years old or older. That's 0.1. Then you add individuals 75 years and older, weighted at 0.2. Then you look at rural persons 60 years older at 0.25. So you've got this real complex formula that's very impressive. It seems to be, make a lot of sense just looking at it as far as a formula, okay? But then when we actually look at the funding on a county-by-county basis, I mean, I can tell you that, the 3 counties that I have, it's very confusing how one county could be $400,000 less than another county with less population. And then I added in, just sitting here looking up, researching some of the different counties across the rest of the state and somewhat close through the northern tier to us, and every other county's got $250,000 more than my county. So, I guess, in discussion with our friends at Bucks County, there seems to be a problem with the hold harmless. So we've got this formula. It seems like we're using the census data, which is great. We've got these weighted factors, which make a lot of sense to all of us. But then when we actually look at the numbers, they don't make sense, the hard dollars, because we're using a hold harmless formula that we can't get rid of.
Yeah. So if you look at distribution of funds across your agencies on aging, you're identifying all the correct factors, right? So there's what census base are you using? What factors do we look at in terms of fulfilling our commitment to the Older Americans Act that calls upon us to serve those in greatest economic and social need, and that's how that formula evolved over the years to what you see and have commented on. And then you have the hold harmless provision that protects a funding base each year. And we need to have a discussion more about the allocation formula and how it's utilized to see if there's a solution perhaps that could be achieved without impacting hold harmless. I don't know if the elimination of hold harmless is the answer, and I think it requires careful thinking before we would take that action. Because hold harmless guarantees a level of funding to the aging network, let's say, as a whole, even if you did an aggregate hold harmless figure and didn't do it area agency by area agency. I think if you eliminate it, while all seated here may be committed to make sure allocations of funds are equitable, we have to also be concerned about those who follow us.
So what about the new money? The new money, the $20 million for the options program, there's additional $5 million for the increased investment in the AAs, $2 million for senior center modernization. I mean, can we take some of this new money that's added to the pool and,
So
and put it to those areas and counties where just the hard numbers just aren't
So
equitable?
What
in
we
any
did,
way?
and David worked very hard on, was using the allocation formula we just shared with Representative Parker, the 60, 10, 10, 10 that you heard,
Right.
And then use the 2010 census base, and then determine a way to allocate that across the Commonwealth in a way which we saw was fair and equitable. And that would have led to increases, or would lead to increases in areas. I don't have the specific county-by-county numbers. I don't know if...
And that's fine. Oh, go ahead.
The distribution of the 20 million was targeted in large part to areas that were, as you previously underfunded under the current allocation formula, which is why we're looking at utilizing the modified allocation formula.
Okay, I don't have that distribution of that new $20 million, and obviously I'm going to have to spend some more time with your department, because when I'm just looking at the hardcore dollar funding, it just makes no sense to me. And look, we understand hold harmless, we understand that, but even with that said, the numbers just seem way skewed in a real negative way towards my county of Pike. Thank you.
Thank you.